Wow. A man believed cannabis healed all ailments, had itchy ears, perhaps eczema? He packed marijuana into his ears. Did this for 2 weeks. It caused irritation and infection. Had to remove it all and disinfect. Huh? A man with diabetes thought turning his soda into a popsicle made it a sugar-free treat. That day, we explained what ice is. Another man with diabetes tried taping his decayed foot back on after it fell off. He got sepsis. Maggots were involved. A guy routinely zaps his penis with a 9V battery to treat herpes. He also shocks himself for other health issues. One man avoids water, never bathes. He also stays home, disliking people, but enjoys church. The local church attempted to assist him, but his odor was so strong they asked him not to return. He dislikes toilets, so he relieves himself on himself. Defecates outdoors. Somehow, he's been married and divorced 3 times? A woman who's always dizzy drinks a 12-pack of beer regularly and feels lightheaded afterward. She's shocked to learn she might be intoxicated. A man calls an ambulance, then threatens the crew with a gun. Still goes to the hospital. Another man brandishes a gun at home health nurses, trying to rob them during their visit to his house. He comes to the hospital complaining his soup tastes bad. Stays a week because he requires unique diapers shipped from a special supplier to his home. He's annoyed we lack HBO or tastier soup. A woman yelled at me in the ER, insisting the MRI I showed her wasn't hers. Her name was on it. Her body shape was visible in the scout image. She then claimed she never had an MRI, despite wearing the MRI wristband from the techs. During COVID, many patients denied being ill until we had to intubate them. They coughed, wheezed, and struggled to breathe, even on BiPAP. Yet they blamed me for making them sick. They all eventually died of multi-organ failure after weeks on ventilators. A man arrives with gonorrhea from an orgy during the 2020 lockdown. He was stunned that I was stunned, but I wore a mask. Me, no condom, though? Sadly, there's more. As a pediatrician, I see many cases daily, but I feel deep compassion because when it's about your children, worry overtakes reason. Many ER visits are for fevers of 99F that resolve with Tylenol, yet families wait 3 hours for me to check their healthy child. It saddens me they spent their time this way, and that they were so anxious during it. More upsetting are naturopath parents, not just anti-vaxxers, but those whose kids suffer from severe chronic conditions like IBD or lupus and refuse conventional medicine. It's infuriating. Their kids endure pain, suffer, and often face permanent damage because their parents opt for baking soda over life-saving drugs for their systemic diseases. Jehovah's Witnesses frustrate me similarly, especially when their infants have critical congenital defects, and they initially reject life-saving surgery unless it's bloodless, which sparks a whole separate illogical discussion. I worked as a medical scribe in a pediatric clinic. A mother came in, alarmed that her daughter was turning black. Naturally, we worried about infection or abuse. Turns out, the child was tanning. She was playing and running in the sun, getting a tan. As a dentist, I told my patient, please, don't use superglue to reattach your tooth in your mouth again.